各位傳媒朋友，早晨！多謝大家今朝嚟呢個先請行政長官發言。
各位傳媒朋友，各位香港市民，今日係9月1日，一個大規模嘅普及社區檢測計劃咧喺今早開始嚇。照我所知咧，到目前為止已經超過1萬位市民係接受咗檢測，當然亦都包括我本人同埋各位司局長。除咗教育局局長咧，因為而家佢做緊訪問嘅，正在而家做緊檢測嘅咧係行政會議嘅非官守議員。整個檢測嘅流程同埋個體驗咧都係好安全、好簡單、好方便、好快捷嘅。正如我早前所講咧，呢個大規模嘅普及社區檢測計劃，對於抗疫有益，對社會有利，
to fighting the epidemic and beneficial to our society. It will also help Hong Kong come out of the pandemic unscathed and also is conducive to the resumption of daily activities. I'd like to thank over close to 6,000 helpers from the healthcare sector helping at the testing centres, apart from not just the team leaders but the sample takers as well. With their help, this testing program can be launched. We provide assistance to manage 141 testing centres. We have also mobilized over 70 departments and bureaus and close to 4,000 civil servants in the program. Civil servants as well as healthcare staff have formed assistant support teams to help at these centres. Yesterday was the second day when we saw a single-digit confirmed cases since the latest outbreak. Starting from the 22nd of July for over a dozen days, we have seen we have seen close to 100 cases. We wonder at that time whether we will see the end of the tunnel. Now we see that there is a drop in the number of cases. It's something that is hard fought for. We have paid a hefty price, say for example, various entry and exit restrictions, closure of various premises, as well as restrictions on our social activities. Once again, I appeal to the general public here to actively participate in this universal community testing program. At a time when the COVID situation has stabilized, this program would effectively help to identify hidden carriers. From the data, we found that about a quarter of the confirmed cases are asymptomatic. You can imagine if someone is infected but asymptomatic, that person would not go to a doctor, and if that person doesn't go for a testing, then every day he or she will be spreading the virus amongst his friends and family. If that is the case, then we will not be able to effectively contain the COVID situation. Their family members and friends might be infected and might even end up in a serious condition. So I ask the general public can see this program in a fair and objective light. I notice that, I express my gratitude towards the healthcare sector. I thank Dr. Koing-man, I thank government medical experts and various doctors for speaking for the universal community testing program. At the same time, I noticed that there are some doctors, in particular, those that come from the Hospital Authority Employees Alliance, appealing to the public to boycott this program. They are staff members of the hospital authority. Their words may undermine the confidence of the general public of this program. In turn, it may dampen their desire to sign up. So I'd like to respond to the various points raised by the HA Employees Alliance. I hope that the individuals of this alliance, having heard my response, would change their mind and support this program. I've done some analysis. There are 6 points of the alliance. I'll reply to them one by one. First, they said that for universal testing program to find hidden carriers, it should be supported by closure and lockdown in place. On the mainland, on the mainland there are quite vigorous restrictions. But as you know, the situation in Hong Kong doesn't really allow complete lockdown. We would like to keep freedom of movement and activities to a certain extent. Hong Kong residents may choose to come back to Hong Kong in the few border control points that are still open. I hope. Well, I don't think that Hong Kong people would like to see a lockdown order. The program is not mandatory. It's a voluntary program. We appeal to the public to participate as far as possible. We know that there will be another outbreak. A large-scale testing will give the experience to the public to let them know that testing is not as painful or difficult as they imagine. The purpose of the program is to identify hidden carriers as far as possible in order to reduce the spread of the virus and in turn to cut the transmission route.
The second argument is that literature shows that there could possibly be false positive results associated with the test, and this would mean that people who have seen a negative result would be reassured of engaging in their activities. Medically speaking, false positive results are something that could happen. So far, there have been 4,800 confirmed cases. The testing process has been vigorous, and certain preliminary positive results have been confirmed by the Department of Health. The tests we are conducting have passed quality assurance procedures as well as the external quality assessment program of the Department of Health. To say that with one negative result, all the social distancing measures can be relaxed and people would not be maintaining their personal hygiene anymore, I think that is a gross misunderstanding. And they also claim that WHO indicated that mass testing is a waste of resources. The focus should be on close contacts and confirmed cases or symptomatic cases. All along, this has been our strategy. Like I said before, given the limited testing capacity, we have focused on epidemiological testing, which is carried out by the Department of Health and CHP. That is for people with symptoms or those who experience discomfort. They would be tested at the clinics, and in July, we have expanded testing to different high-risk groups, including people who are at risk due to their occupation or those who belong to certain clusters. For example, those in elderly homes. We have conducted hundreds of thousands of tests for these groups, and now with support from the central government, we are conducting a one-off universal community testing program for everyone who is willing to be tested. People have demanded the government to provide free testing, and we are satisfying such need. And what we are doing is not in conflict with the WHO. The WHO has always stressed that the anti-epidemic measures adopted by a country or place would depend on its circumstances, and with the support of the central government, we are now in a position to carry out mass testing. The WHO never negated the importance of testing. Like what an expert from the WHO said before, the key is test, test, test. Only with testing can we identify carriers, and statistics show that a substantial percentage of patients are asymptomatic. Another claim is that the mass testing carried out at the testing centers is high risk in nature. I'd like to stress that in terms of infection control and hygiene conditions of the 141 testing centers, they have been assessed by the DH, and we have prepared for all possible scenarios. We have also prepared ample personal protective equipment, including protective gowns, face masks, etc., for use by those at the testing centers. Yesterday, there were widespread reports containing an explanation from a doctor on the work we have put in. Another claim is that these testing centers are located in congested areas, and our choice of venues has been questioned. Our criteria include the sufficiency of space, and the locations must be convenient to the public. If we identify venues that are not very accessible to the public, we would not be able to achieve our goals. And upon assessment by the DH, the residents near these centers would not be affected by the testing program. There is a claim that such mass testing is not the best way to contain the virus. The best approach should be border closure. I agree that personal hygiene awareness should be enhanced, but in terms of claims for border closure, we have been hearing such claims since January. And with the stringent immigration controls and consolidation of ports, for Hong Kong residents returning to Hong Kong, we only kept the Hong Kong International Airport and 2 land-based ports open, and in August for these 3 ports altogether, on average, there were only 1,200 travelers per day, the majority of which were Hong Kong residents. They enjoy the right to travel under the basic law. And there were also a small number of people who had to travel to maintain the needs of Hong Kong. For Hong Kong residents returning to Hong Kong, they might be friends or relatives of people who are against this testing program, including students returning overseas,
咁所以呢啲就係而家每天
or foreign domestic helpers who are reporting to work in Hong Kong.
我相信呢個所謂又封關嘅口號咧，去到今日唔應該再係一個議題。所以
I don't think we should really be discussing these claims for a border closure. We should focus on epidemic control so that Hong Kong can step out of the pandemic as soon as possible.
喺過去呢8個月嘅抗疫咧，
Over the past 8 months,
但我最愛
as
護
Chief
最保護嘅係
Executive,
醫管局 包括醫管局所有
I
嘅
have
員工
sought to protect the hospital authority, including all HA staff.
我喺親自領導嘅工作，往往都有醫管局嘅
Since January, when our work started, our work often involved the HA Chief Executive, Dr. Ko, and initially with the shortage of face masks,
係根本唔願意俾內地嘅口罩供應商出口。
at that time the supply of face masks was extremely tight.
上海一間口罩廠係先供應俾醫管局。
I sought help from the central authority to give priority to the HA in terms of face masks, and the supply came from a manufacturer in Shanghai.
除咗喺中央嘅官員，亦都有上海嘅領導親自關心。
Officials from the central government and the Shanghai government offered support, and as such, we were able to receive a supply of face masks from a Shanghai plant. As for the opening of the second hall at Asia World Expo for community treatment, the HA was unable to procure beds, and with the support of the Shenzhen government, they supplied 400 hospital beds to the HA. Apart from the UCTP, 2 other programs receive support from the central government. One is to set up an additional 1,000 beds at the Asia World Expo community treatment facility, and to allow the HA to prepare for the new outbreak. A new makeshift hospital with 800 beds would be set up. All the support seek to reduce the burden on the HA. At first, I was told by my experts that there would be outbreaks, and this is inevitable all around the world. And the key is to protect our public healthcare system. If the healthcare system collapses, as you can see in places like the US and Europe, you can see how dire the consequences could be. That is why all along we have been supporting the HA. Under the first round of the Anti-Epidemic Fund, we earmarked $4.7 billion to the HA. We would provide whatever they need, and the funding allowed the HA to offer subsidies and procure various supplies. Given the circumstances, I hope the HA Employees Alliance could objectively and fairly look at the efforts of the SAR government. They should embrace their professional expertise and urge the public not to turn their back on the program, because the program would be beneficial to the community and the HA as a whole. Thank you.
Now it's question time. Please raise your hand. Identify your organization.